My name is Latoya, and I'm with Because I'm a Nurse. I help nurses find balance, support, and motivation so that they improve their practice and live their best nurse lives. I also help student nurses study, learn, and laugh. Very excited to have Felisha Hilbert here with us today. We are going to start a series called Culturally Competent Care. So we're very excited that she could speak with us because she's completely amazing. She's a nurse, she's an activist, an educator, and a global health advocate. She has wide expertise in health and education. Actually, in 2019, she was named a White House Champion of Change in Education. She was also recognized by the United Nations as a protector of progress. So she is amazing. She also created a small clinic in Mexico that provides free preventive care for people who live far away from medical facilities. She's educated Mexican leaders in the areas of health and education. She has been a Shot at Life champion for global vaccines since 2012 and a champion leader since 2014 until present for the states of Texas, Kansas, and Oklahoma. She's very active in the community. She works with the American Heart Association, and she has for the last 8 years promoting heart health in the Latino and Hispanic communities. She is committed to teaching immigrant families how to better their lives and how to support children in their education goals. So she is just a wonderful, wonderful woman and is a great person to have this talk with us today. As you can see, she has the background and the education to have this discussion. So we're hoping this will help you understand how to care for different cultures. Okay, so we'll just jump in and get right to it. So one of the first questions I had is, why do you think people assume that people of a Hispanic origin and a Latino origin are the same? Why do you think that happens?
Oh, that happened a lot. I thought I was a ELL bilingual assistant and work in Broken Arrow Public Schools. Mm-hmm. And they always thought that everybody who looks Spanish and speaks Spanish, they thought that the Mexicans, they always thought that everybody was the same. It's because they speak Spanish, and they always had a little misunderstanding about that, because they said, "Oh, do you speak Mexican?" And I said, "No, I speak Spanish."
Yes, Mexico is a country.
It's a country. I was born in Mexico, and I said, "Well, are you Hispanic or are you Latino?" And I said, "Well, let me explain you. Latino and Hispanic. Latino is everybody who lives in a Latino American country."
Yes.
And look, I have a chart that says how many countries.
Yes, so a lot.
We had more than 24 countries who speak Spanish. Mm-hmm. But the ones who are Latino America, North America, Central America, and South America, they are called Latinos. Mm-hmm. And Spanish is everybody who speaks Spanish, but we have 20-something countries who speak Spanish. Yeah. So people don't know. I think it's very easy to assume that you're brown and you speak Spanish, you're Mexican.
Yes.
You're Peruvian. But it's kind of hard, because sometimes people say, "Oh, are you Peruvian?" And I don't get offended. I said, "Yeah, well, I am Spanish." And I am Hispanic because I speak Spanish. And my father was from Spain. So,
oh, wow. So, yeah.
So I am Spanish for that reason. He was a Spanish descendant from Spain. My mother was from Mexico native. So I am Spanish because that, and I am Latino because I was born in a Latino American country. So you can be Hispanic and Latino, or you can be Latino. But you need to ask people, because some people get offended. Some people get, "I am Peruvian, I am not Mexican."
Yeah. So it can be a very sensitive subject. So the rule of thumb here is just, if you don't know, ask them, right?
Ask people, "Where are you from?" Because I like to pronounce your name, and they are very happy to. I want to pronounce your name very well. Yeah. And I want your identity, because we know we speak Spanish. But yeah, that's the reason.
Awesome. And then another question I had is, what do you think are the healthcare challenges or barriers faced by Mexican or Mexican American people here in the United States?
I will tell you something that I deal a lot with, that is the language barrier.
Yes.
Language barrier, because we had parents in my school, they have been here 20 years and they still speak English because they don't go to school, they are busy working. So language barrier will be one. They don't know the English language. So they are very needed to someone to translate. And sometimes the people who translate are the kids.
Yeah.
Their sons, daughters, and sometimes they don't translate correctly. Yeah. So this is barriers. Another barrier is immigration status. A lot of Mexicans and Latino are illegal.
Yes.
So if you don't have a legal status in this country, you cannot have a driver's license. You cannot do a lot of things. So that immigration status is kind of hard with the help, because if they don't have insurance, sometimes they don't want to go. Oh, because it's going to be very expensive. I don't know. I have to go to the doctor. So you have to treat them like a little kids and say, hey, we have programs here that will help you.
Yes.
But yes, that will be something, poverty. A lot of people work hard and poverty levels are kind of low.
Yes.
Education levels, many people who come to United States, not the wealthy people who comes to United States, many of the people who comes to United States is the poor people who wants to have a better life for their family.
Yeah.
So the education levels are medium. Sometimes they finish elementary school, middle school, or sometimes we have people who come to our doctors and nurses and everything for different reasons, you see. So it is a very different situations. We have a lot of barriers. People are scared. People have education levels. Sometimes they prejudice. They think, oh, what are they going to think? It's another people. Sometimes people say, oh, another one who's going to get free services.
Yes.
So that I was in the hospital helping one of my family's parents, and somebody said another one who's not going to pay, someone who was waiting. So that kind of hurt.
Yeah, and it does, and I've had people say that too, that the reason why healthcare is expensive is because people who are not legal in the United States are using the healthcare services and not paying. But I've been a nurse in the hospital working, and they don't come to the hospital. Very rarely. If you have a Mexican American in there, they have insurance. They very rarely come to the hospital. So I feel like that's a misconception too. They are not actually getting the care they need because they don't go. Yeah. So.
Exactly, you're right. A lot of, and this is what I was telling. I think you had a misunderstanding, misconception there, because it's not only the Latino Spanish. We had a lot of people who goes for these services.
Yeah.
So when you categorize them, I said sometimes they don't go.
Yes.
They don't go until it's sometimes very late.
Yes. Yeah. Until it's too late. Yeah. Until it's emergency, exactly. and that's not good.
Exactly.
Yeah.
Exactly.
Okay. So are there any cultural nuances that nurses should be aware of when caring for Mexican or Mexican American patients or Hispanic patients?
Yes, I think it will be something that, I don't know if you know this, but in Mexico and some of the Latinos countries, medicine is socialized. That means you don't have to have insurance. We had tons of doctors, and doctors open their practices. And they receive, you don't have to make appointments, you just show up over there.
Oh, wow.
And they will take it according how you're coming, and you show up, you don't have to call anybody, you bring your cash. And doctors and nurses treat you very well, because if you don't like them, you can change doctors tomorrow, because you don't deal with them.
Yeah, so there's an incentive to do well.
Exactly. Yeah. You don't have to to really, what I like about it is because this happened, doctors and nurses take care of you so good when they are there. You're
Yeah.
there. I was in Tasco doing a humanitarian work, and I got very sick with guides.
Yeah.
And I went to the doctor, and look at the experience. And I will tell you, I don't have an appointment. I went, and they said, "Oh my gosh, you need a breathing treatment." They give me a shot. Somebody put the breathing treatment. Somebody doing X-rays because I had some condition, and everything was done in the same place, 2 hours, and I pay like a 1,500 pesos, less $100 and something with all the service.
Yeah, that would be thousands of dollars here. And you wouldn't get it all done in the same place either. So yeah.
In 2 hours, everything was done. And the x-rays came, he read it to me, and I said, that's the reason I love the service.
Yes, we need some of that over here.
But you had to have cash because not a lot of people use credit cards, especially the poor people. They come and they have their cash.
Yes.
That's it. So it's very different. So that's the reason. It's a little solid difference. But if you go to dentists, I will tell you, dentists in Mexico, you go for a cleanup for $5 to $10.
Wow.
You go to do a crown for 150 pesos, $150.
Wow.
$100.
That one
crown.
Here.
So I do a secret. I do all my dentists in Mexico.
Yeah, I have a friend that did that too, Ramona. She would go right down there, yeah, because it was a lot less expensive.
Less expensive, and you don't have to pay. You don't have to make these big lines or transfer. They have all the service ready for you. I just make sure this very clean and sanitized and everything.
Yeah.
And I already, yes, that's it.
That's awesome. Okay, so what are some of the common beliefs about pain in your culture?
Okay, that's what I was saying. All generation, they believe pain is kind of your companion. You know, they're so used, people are so stoic, they can have pain and they can be working, they can have fever and they can still go to the job and everything. They are so used to these conditions of life. And I am talking about little towns. You go to the big cities, it's a different story. But pain, so with this patient, you have to be very careful because they are not used to report pain. They will not tell you. So when they tell you about pain, it's because they are really having a 10.
Yeah, so it's like you really need to listen and pay attention because they wouldn't normally report it.
No, they will not report it. I practice nurse over there, and I had to ask you, okay, hurts? No. Okay, touch it, push it more harder. I said, yes, you had appendicitis. You have to go to the But they will not go, and that's the reason we lose patients because they are so used to pain that they don't go to the doctors. They believe it's normal. I had this pain, but it's okay.
Oh my God.
They don't know their body, lack of knowledge of their body, how they function to the certain things it will give you. So they don't know about, like one lady was bleeding. She was pregnant and she was bleeding and she said, I think I have my period, but I thought I was pregnant. I said, you're pregnant. So is that normal? I said, no, really?
No, like not at all, yeah.
So you need to really check and be very aware of these signs. And sometimes you have to be the one reading his faces and the pain and see and checking very carefully because they will forget to tell you because they are not used to complain.
Wow, that's amazing. That's good to know because, you know, being an American and living in the United States, we're used to people, that's what they do. That's what they've kind of been trained to do here. And so when we're not getting that same thing from a patient who has a different culture, then they may not get the same treatment as this patient that speaks out. So we just need to delve a little bit deeper, right? And make sure that we're addressing those pain needs. And then, so what is the best way to ask about pain level.
Okay, you had to insist, be persistent, and first of all, don't get that for nurses who only speak English. Please don't be afraid that you don't speak Spanish. Just your smile and genuine. You have to gain the trust, because in Mexico and other Latin American countries, they sometimes with the government it's not trust, but the doctors and nurses are very respected in my country.
Yeah.
So if you get the trust, or then like you smile, and we our patients are very touchy. Now with the COVID-19, maybe you cannot do it, but we are very warm, the personal touch, personal care. This is the reason I like nursing in another countries, because I can spend time with them and I don't spend time filling paperwork. Because here you have to do a lot of paperwork. And I was telling, oh, I want to be a nurse to be with the people, to do the I need to do with the people. I don't want to fill papers. But anyway, over there, you spend all this time with them. So that gain the trust. When you gain the trust, you will have tamales and Mexican food for the rest of your life.
So that's all you want to do. Taco Tuesday every day, right?
Yeah, I can tell you that, because as a teacher, I gained the trust of these parents when I used to teach. And oh my gosh, they will bring me lunch almost every day because they are very grateful. So gain the trust, be smile, and be genuine, because people can read if you really care for them or you don't care for them. So be aware of your face, of your countenance, or how you approach them, because that will make them trust you or completely reject you.
That makes sense. And I think that can work in all cultures, really, that bit of advice. Yeah, okay, so how do you say, I think I have it right, so if you want to say pain in Spanish, or do you have pain, it's tienes dolor, is that correct?
Tienes dolor.
Yes.
Tienes dolor, y can you say tienes dolor, or te duele aquí, and you can point to the part that the pain is. How is your pain? Maybe I can send you some phrases. I remember
that would be great. Yes.
Translating a lot for doctors. I think I did a class at TCC about Spanish for doctors and nurses, and I don't know if I had the papers, but yes, tienes dolor, and get all the nurses there. Get this. Just be warm, smile, and tell them, I am here to help you in any way I can. I don't speak the language. Maybe they will not understand it, but they will smile. They will know that you care. And this is the more important thing. Show them that you care, because with that, they will tell you, oh, I am in pain. Or will tell you. And you can say, it is the pain. You have to explain like a little kid. Okay, pain 1 to 10. If you had 5, it's okay, but if you had 7, 8, 9, or 10, you need to tell me, because that means lots of pain. Yeah. That means something is bad in your body, or something is not working. So you have to take the time and guidance by the hand, little by little, to explain and be direct. Don't expect them to tell you. Oh, they will report you. Oh, I have pain. No. You have to be the one. Good morning. How are you doing this morning? Yeah. Oh, how is your pain? ¿Te duele aquí? Are you okay? Okay. And touch it. And they will say, oh, okay. That will be a 8. So sometimes you have to test it. Yeah, that's the best way. That's the best way to do it.
Awesome. And what about medications? Are medications frowned on, or are they like acceptable? Because I know in some cultures, people don't like it. With African Americans, sometimes they just don't want, they're just not going to, you know, it's part of the culture where they're very suspicious of doctors and medicine. And so sometimes you get compliance issues.
Exactly. Well, in Mexico, doctors, like I said, doctors and nurses, teachers are very respected. So if a doctor prescribes you something, they will take it. Yeah, nurse said that you have to take it. They will take it. They don't have any problem with it. But some old generations don't believe in medicine. So
Yeah.
they take it. You know, I had a kid who died in my arms because the mom, he had diarrhea. I was just starting nursing, very new in my profession. And now I volunteered to do preventive medicine in a little town. And this lady's mom came with a baby. He has had diarrhea for the last 3 days. And because they are not educated, she was giving it a little tea and thinking that he will be okay. Well, when we went to that little clinic, baby was dying.
Oh my gosh.
Nothing we can do. He died for diarrhea, preventable disease, just because she don't knew that she had to take it to the doctor because he thought, oh, it's a diarrhea, it's easy. I don't have to do nothing. Measles. Measles are so common in developing countries, and they think, oh, I can put a little flour and that will be okay.
Yeah.
They don't know about the concept. It's a lot of lack of awareness and lack of education, especially in little towns. So some of these people who come from other places who are here with the low education levels, sometimes they don't have any idea how difficult it is. These diseases that they can prevent it. Religions too had a lot to do with medicine. I don't know if you know, but you have witnesses. They don't let transfusions.
Yeah, they don't do blood transfusions. Yeah.
Blood transfusions. So you have to ask about religion. What are the things? Just a little things to know. But normally people will take medication because the doctor prescribed it. That means it's okay. I need it. They will trust you. The majority of people, we had maybe 20% who has these beliefs that they don't know about the diseases or that they have religious issues. They will not take medication. But 80% of the people will do.
80%, that's awesome. Okay, and then are there any foods that are culturally significant or preferred when people are sick?
I have been in the hospital a lot and find myself and with some families, and I was telling them, in the Latino culture and Mexican culture prefers food when you're sick, soups, any kind of soups.
Okay.
No,
Even cold? Even cold soup?
No, it has to be warm.
Warm soup.
Warm the soup. Chicken soup, fish soup, shrimp soup, pozole, beef soup, everything who has the juice. When you're sick, you had this in Mexico. My experience in Mexico, I was praying to be sick. Because when you're sick, they give you all these special foods that you want, everything that you want. And going to another question goes together. All the family gets involved.
Yeah.
All the family comes together. And when I'm talking about all the family, I'm talking about aunts, uncles, cousins, friends. Everybody goes to see you, and the custom is to come and bring you something.
Yeah.
So they bring you favorite foods when you're sick. And they get so involved. They are asking, how is she? Is she doing? You need to take it. We are so close together. You know, it's like African American.
Yes.
You know how we do these big parties.
Yes.
Exactly. Very much. So yes, soups, jellos, flans, soft, no dry foods. No
dry fruit.
No toast bread or things like that. They like soups, a little more substance, because that's what we used to. We were born and we were raised with that.
Yeah, that's awesome. Okay, so we talked about how the family is involved. So, you know, kind of in American culture, we're taught to speak directly to like the patient and to ask them questions. But if there is family there, how do we do that? Do we direct the questions toward the patient, or do we direct that to like the person in charge of the family?
Okay, you're doing perfectly when you said yes, you have to talk directly to the patient and talk in. But normally somebody will be responsible, like the husband or the older son or daughter. They be there always. And that means that you can talk in front of them. You guys can talk the cases, at least explain the care, how it's doing, how it's reporting and everything. But if you had too many people there, you can ask very cautious and said, hey, I need to talk to can you guys get up upside a little bit? We need to talk about some of the patients, how we're going to follow up, or what the doctor says or something. And just something else you guys can do is ask the patient directly if his conscience says, will be okay. There's a lot of people here. We need to talk something. Do you want me to say it, or you want me to just say it to you and your daughter or your son or your husband? So they will tell you normally. And normally they want to be private. They like that private. They don't like a lot of other people to know.
Yeah,
no matter your family.
Yeah.
So just, but the person who stay at the night over there, that will be okay perfectly. But I find now they asking them, they love it because they feel involved and like you.
Yeah, and involved.
Asking, exactly, and they feel like you respect them enough to give them that choice, that decided. Because one of the patients told me, she says, I feel so afraid being here. She don't speak the language. I think she don't speak the language. And she said, you know, I don't speak. My husband has to work and I have to be here by the night by myself. And he says, my kids have to go to school and I am naked and I don't speak the language and I want to go to the background and I don't know how to say to them they need to go to the background. So I wrote some things in English in practice. I said, you need to tell it, push this thing and said, hey, I need to go to the background. What happened if they get mad? I said, she told me, what happened if they get mad because they seem too busy? I said, no, they will not get mad because they are here to take care of you too. Exactly. So you tell it. But she was so afraid, so she almost peed her pants because she don't want to call anybody.
Bother anyone? Wow.
She don't want to bother anybody, and she was afraid because she don't know how to say it.
Yeah.
How to speak. So it is kind of nerve. So you need to make sure to take that in consideration because they will be nervous about it.
That's good to know. Okay, so are there any stereotypes that you would like to put to rest?
Let me see. Stereotypes. Well, first of all, I just because I work and I have seen it, is just nurses. Really, I was explaining that, and maybe that's something, stereotypes, because sometimes they assume, the certain patient, or he comes here again, or something like that. So Mexicans, Latinos, and everything, they will be going to the hospital only if they need it. They will not be there if they can go.
Yeah.
So not every one of the ones who go to the hospital is illegal.
Yes.
So please, I think I remember a doctor who came and he was so upset because he says, they thought that I was illegal. And I said, why? Because I cannot speak in that. And I said, well, it's okay. I said, and I explained that to them, and maybe you can explain that to the rest of the nurses, is that, don't assume because you see someone, just see it, they isn't educated or they is illegal. Because I had a lot of people here who had a doctor's degrees, attorneys, psychologists, and the problem is they don't speak the language.
Yeah.
But they are educated. They are educated. So these stereotypes about assuming appearance, please don't. Give people the second chance.
Yeah, and I feel like as a nurse and as a healthcare provider, their legal status doesn't even matter to me because I'm here to take care of you. So it doesn't matter I feel like their legal status shouldn't matter when you're providing care.
It should not matter,
to provide care like that. That has nothing to do with you. Okay, so what do you think is the most important thing for nurses to remember when caring for people of a Mexican, Hispanic, or Latino background?
Latino. I think the most important thing to remember is they are human, that they have the same needs, that they maybe look different, but that we had so many similarities together. Yeah. So they have the same need. They need to be respected. They need to be loved. They need to be accepted. And they need to be us. Yes. When they need to that. Because if they feel it, like I said, you will get friends for life. And they will follow you and they will say, Miss Smith, here is this food for you. Or Miss so-and-so, I cooked something and I remember because you were so good to me. Yeah. Because they are so needed affections. I was worried this time because the COVID-19, I had a friend who his father was in the hospital for 6 weeks. He has been intubated and in coma, almost 6 weeks. And she cannot, she will cry every day because she cannot be with them. Yeah. No one in the family can be there then. Mm-hmm. So emotionally, I was getting through to emotional help. And I said, okay, this is what you have to do. You know, it's not because they don't want you there, it's because what is happening, we had to obey. You know, we had to stop this COVID. So they were having such a hard time. Yeah. Because they said I don't know what to do. I said, the only thing you can do is pray. But I want to assure you that the nurses and doctors are doing everything they can because in this time, for them, he is a human life. He don't care about the race, about he speaks or not speak. They know what to do. They are professionals. They have been trained for that. So I assure them, but we had a lot of Latinos that had been, because they don't, and now I give it a tag. I had a tag in Spanish and I said, you know, you need to follow these guidelines to stop this, because when you keep playing and going to Plaza Santa Cecilia or going to a dance because you cannot stop the party, you are not helping to stop the COVID-19. So, Awesome.
Is there anything you want to add?
No, I just want to tell you it has been a pleasure. And any questions, just let me know because I will be here to answer. We're the same.
Also, I have two more little questions. So the last question is, how do you find work-life balance? Because you are so involved, so busy. You do every day on Facebook, you're somewhere new doing something for someone else. So I was like, how does she balance it all?
Well, it helps a lot. I started out, I was very young when I started. I was a missionary when I was 21 and I led my house for 2 years and I just fell in love. Yeah. Fell in love with communities. So I always, when I married my husband, I said, this is what I do, and I hope you know that I'm not going to change.
Exactly.
So I work, I don't know, you know, I designed jewelry and sell it because I had
beautiful. Yeah, I see.
You need to come and visit me to see it. Anyway, balance, it helps a lot now that I am an empty nester. Before, I will do all my spring breaks, all my school breaks, fall breaks, spring breaks, Christmas breaks, and I will do humanitarian missions as a family. I will take everyone with me and we will work 2 weeks or 2 months, depends on the time. And later, my husband got sick and now he is an immune system compromised person who is, so I retired early from education, but I had more time to travel. But I do a balance. I am an early morning person. I work 6 o'clock in the morning. I spend a couple hours for myself, meditate, read. And I am a happy person. I am excited.
You are a happy person.
I am a very service-oriented person. So I believe that my life is more rich when I do something for one else. So I try every day to do something for everyone else. Drop a meal, send a car, make a basket, whatever. Especially the people in this COVID-19, I have been doing baskets for people who don't have families. I just drop it in the doors and
That
let
is
them know
so
that I am
nice.
thinking with them. So, but I had to have time for myself. I had 2 hours or 3 hours every day for me. This is Felisa time
Yes.
to renew, to be excited into doing and teaching, because I am teaching. Yesterday, I was doing American Heart Association work because we're going to have a class today, 7 in Spanish.
Oh,
So teaching everything in Spanish to the ladies. So from Oklahoma City, from every place, and questions about the heart health, nutrition, all these things. So I spent all my day. By 9 o'clock or 10, I was full. I went to bed immediately. So I had to have time balances like that. You have to priorities, set your priorities. Something else, I am a planner. I had to have a calendar.
that is so helpful. Like when I don't, it's a hot mess over here.
Exactly. I don't work well with people who don't plan at the last minute.
Yeah.
And it's, okay, I want you something to do this, and because that's not me. I want to do it right. Yeah, like I had to tape something, and I said, you need to send me what I need to say because I don't want to do it at the moment when I had to read it. Yeah. So I need to plan in advance. My calendar is full. I give me 30 minutes, something to give me balances. I never say yes to 2 or 3 things in one day. Yeah. I just put the number. What can I do today without stressing me out? Because I'm not going to be good. Yeah, I am stressed out. I told my friends, learn to say no. No matter how. I know you can do it, but learn to say no, because you have to be your best friend. You have to nurture your head. You have to be, especially take care of yourself to be able to give to others. As a nurse, I will give you that. You take care, spend 8 hours or 10 hours in the ER or any place. And do you know what nurses do? We drain ourselves completely, because I have been there. Because you want to care for this patient. Sometimes you feel guilty because you don't have enough time to spend with the patient over there. And you eat very fast and go home, and you're a mom, you have to cook, you don't rest. So you need to take care. You need to go to the spa, paint your nails, do something special for yourself. And I do all these things because I was telling, I cannot be good preaching these things if I don't do it. Exactly. So that gives me balance. That gives me balance. I know myself. I know my body. So I feel like today I don't feel good. I'm sorry, but I cannot do it. So today I had you and I had lunch with my friends at 1 o'clock. They were going to have the lunch together, couple only, just to be a girlfriend. That will be my Felisa time. Yes. And later we have a webinar and tomorrow I had a class for the Spanish. And I'm very excited because I don't know if you know about Vestido Rojo.
Yes, I've seen it. Yeah.
I organized that with the American Heart Association.
That's amazing.
In Spanish, everything, presenters, all the classes, and we do it every year for 700 women, Latino, Spanish, to educators. So we need to invite you just to come to see. Yes, when is it? We are planning this one for Saturday, November 21st.
Okay, yeah, I definitely want to come, so I'll keep in contact with you.
But we're planning it together. It's going to be 750 people. And we were able, for Walgreens has been amazing to us. This year is going to donate 800 vaccines.
That's amazing.
Flu vaccines.
That's amazing.
I am very excited about it. We do all this service free. We don't charge it. It's going to be in the Renaissance. So we have been working on this. And I am hoping that we can do it in person, because we're planning it to be in person.
Yeah.
by November, I am hoping.
Yeah, we're praying, right?
Praying for that. But yeah, this is it. This is with this COVID-19. This is what I told my friends in one class. I said, you have to have a routine. Dress up every day. Put your lipstick. Have a routine. Mental health is very important. Mental health.
Yes,
it's the more important thing because mental health is connected to physical health.
Yes.
Nutrition. Very good nutrition. Exercise. Go for a walk. Do something. And create a habit. They said, I have a lot of time, I'm so bored. I said, hey, do you have something you can do? Paint or crochet or cross stitch or just take a class or something online. But yeah, that will give you a balance. That's what will give me balance and keep me on shape.
Yes.
So I think I answered.
You did, and it was a great answer. I loved it. I just want to thank you so much for talking with me today. And this information is so good. It's going to help so many people. So I just appreciate you. And then definitely keep me up to date on Vestido Rojo, because I want to be involved. I definitely want to either help or be there for the event. So thank you so much, Felisha. You have a great lunch today.
Oh, thank you. I hope you are doing a great time. And thank you, tell all the nurses. We're here to help anything. And we will go and check your website later, okay?
Yes. Thank you.
Thank you. It was so nice to talk to you.
It was.
Oh my gosh, the time went so... Hey, the time went very fast.
It did.
I was thinking, okay. Thank you.
Welcome, bye.
Bye.